Good morning, guys. In this video, I'll be talking about type 2 diabetes. Okay, type 2 diabetes, or also it is known as non-insulin dependent. Sorry, there is no hyphen in this. Non-insulin dependent diabetes, or also known as maturity onset diabetes. Okay, maturity onset diabetes, also known as type 2 diabetes. It is basically occurs at the age of 40 or above 40s. People that get the type 2 diabetes is now in this case of type 2 diabetes, what happens usually, there is a insensitivity of the cell to sense the increased level of insulin. Okay, insulin level increased in our body, okay, at a very high rate, but our cells cannot sense it. Okay, there is a huge amount of insulin in our body, but our cells, they cannot sense the high rate of insulin that already has deposited in our body. And instead of that, what happens? Pancreatic beta cells continuously produce insulin onto that. So there is already increased insulin concentration or level in our body, and in addition to this, beta cells cannot sense it, and they will produce more and more insulin at its normal level. So insulin increased in our body at a highest level, and that is actually known as insulin resistance situation in our body, which causes type 2 diabetes in us. So there is the comparison between type 1 and type 2 diabetes is type 1 diabetes is basically insulin dependent, in which there is a deficiency of insulin in our body. You need the injections of insulin or transplantation of the beta cells which will produce insulin. But in case of type 2 diabetes, there is a high rate or higher amount of insulin in our body, and our body cannot sense it. In addition to that, beta cells, they will produce more and more insulin. So there is an insulin predisposition in our body, okay, which will cause the type 2 diabetes. Thank you so much.